Hello, my name is Evan Deal and I'd like to welcome you to my speech. Today I'm going to be demonstrating how to properly take someone's blood pressure. So, blood pressure is the force exerted on the arteries by the blood. This is due to the circulatory system pumping blood throughout the body. Blood pressure is measured in two numbers. You're going to have a systolic number, which is the top number, and your diastolic number, which is the bottom number. So blood pressure is a very important part of health because it helps the healthcare provider see if there are any possible health risks associated with high blood pressure. High blood pressure can lead to heart attacks, strokes, heart failure, kidney disease, and many other health risks. So when taking blood pressure, there are three basic steps. You want to first gather your materials, execute the procedure, and then understanding the results. So first we're going to start off with gathering our materials. The first thing you're going to need is a stethoscope. So a stethoscope is a medical instrument used by healthcare professionals to hear many different sounds. So you can hear heart sounds, lung sounds, or in this case we're going to be hearing coracough sounds, which are the sounds that the arteries make when they're pumping through the blood. The main parts of the stethoscope are the earpieces, and then there's tubing, and then the bottom part is the diaphragm. The next instrument you're going to need is a blood pressure cuff. So the blood pressure cuff has three main parts as well. You're going to have your gauge, and then the actual arm cuff that goes around the patient's arm, and then also the pump, which pumps the air into the cuff. On the pump, there's a little valve. This is what you use to loosen and tighten the cuff to release air or keep air in the cuff. So then after you have gathered up your materials that you need, you're going to move on to executing the procedure. The first thing you're going to do when you get to your patient is ask them if they have a specific arm that they would like you to use. Sometimes it could be just because medical reasons or just their personal preference. Do you have a specific arm?
No.
Okay, so the next thing you want to do is make sure that you have the proper sized cuff. If it's too big or too small, it can give you inaccurate results, and so you want to make sure it's properly sized. The next step is have them straighten their arm and have their elbow facing down. And on most blood pressure cuffs, there's going to be an indicator on pointing with arrows pointing, and so you're going to place that down on their arteries and tighten it so that it's tight enough so it won't fall off, but not too tight on their arm. The next thing you're going to do is grab your stethoscope, and you want to make sure that it's placed so that the diaphragm is facing you. That way you can just hear it better. Once you do that, the diaphragm is going to be placed right below the cuff on the brachial artery. It's in like the elbow crease area. So after you do that, you'll then grab your pump. Make sure it's tightened all the way so then when you pump it up, air actually stays in the cuff. So after you do that, you're going to pump it all the way up, and you want to get it in between the 160 and the 180 range. If you go much higher than that, it can start causing the patient discomfort, which we do not want to do. Once you pump it all the way up there, you're just going to slowly start releasing the air. So you're going to loosen up the valve, release the air until it starts slowly dropping down. And with your stethoscope, you're going to hear those thumping sounds. And your first one's hopefully going to be between like 100 to 120 range. And that first thump you hear is your systolic number, so that top number. And then you're going to keep listening to those sounds. And the last thump you hear, which should be around the 80 to 90 range, is going to be your diastolic, or that bottom number. So I'm going to just take her blood pressure real quick. Okay, for her, I got 118/78, which is very healthy. So the next step, you can just make sure to undo the cuff so that they can loosen up their arm because it is pretty tight around their arm. So now that you have your results, you want to understand them. So the healthy range for systolic blood pressure is going to be between 90 to 120, and for diastolic, it's going to be between 60 to 80. And so if either of those numbers are read below that, it's going to be considered hypotension or low blood pressure. And if it's above that, it's hypertension or high blood pressure. So if these are occurring frequently, I recommend to go see a healthcare professional to see if there are any health risks associated with those readings. So once again, the 3 basic steps to reading blood pressure are gathering your materials, executing the procedure, and understanding the results. So hopefully by following these 3 steps, you'll be able to take blood pressure and be confident in it. So thank you for listening to my demonstration speech.